My name is Rich Prinz with EarthSafe Chemical Alternatives, and we're actually known for our EverClean infection prevention solution. And along with Dan and Mark, I'm here to talk about advanced technologies for infection prevention. Dan and Mark are actually going to be talking about safer chemistries and also reduction of HAI, best practices in the healthcare environment. And I'm actually going to be talking on the electrostatic advantage. Electrostatic sprayers have been around for several years, but really gained popularity in recent years, especially the last 16 months. And Direct Supply has actually embraced this technology well before the pandemic. But before I talk about the electrostatic advantage, I'm going to start with some of the basics. It's important to redefine the science of clean. As we all know, a clean-looking surface can be very misleading. Just because something looks clean doesn't mean it actually is. Some of the facts: in 2020, there were over 136 million cases of COVID-19 worldwide and more than 31 million cases in the US alone. And on an annual basis, over 26 million people get the flu each season. Well, not this season. It was actually pretty much non-existent based on some of the proper measures, PPE, disinfecting, hand hygiene, and social distancing. One thing to note, about 18,000 viral particles can sit at the tip of a pen. Not this pen, because I disinfected it about an hour ago, but in general, just the tip of a pen, 18,000 viral particles can sit at the tip. And as little as 18 invisible viral particles can make you sick. So simple math, one pen can make up to 1,000 people sick, which is very alarming. Okay, so this is just a visual of the history of pandemics from the very beginning. And as you can see, there's many of them, but really focusing on the last 20 years with SARS and MERS, Ebola, swine flu, and then of course, COVID-19 pops off the charts. With over 330 million people in the US, every single one of us was impacted by COVID-19 one way or another. But utilizing this visual to see that COVID-19 wasn't the first pandemic, and unfortunately, it won't be the last. So it's imperative that we come up with proper protocols and best practices for infection prevention, not only in healthcare, but in all industries. So this is something that seems simple, but as I talk to people throughout the country, there's a lot of confusion on these three: cleaning, sanitizing, and disinfecting. So cleaning is actually removing visible soil, debris, microorganisms, and organic substances from the surface using detergent water, soap and water. There's really two reasons to clean: for health or for appearance. And I'd be willing to bet in the past some businesses were cleaning due to appearance, but it's more important now than ever to clean for health. Both reasons are important, but health needs to be top priority. Sanitizing is actually reducing bacteria until it's deemed safe by public health safety standards. The key word there is reducing. And then disinfecting actually eliminates pathogens and disease-causing microorganisms by using an EPA-registered chemical. So traditional cleaning methods typically get you up to 25% of the surface coverage. That's your trigger spray bottle, mops, buckets, rags, even your disposable wipes. And really, there's so many difficult to reach areas that are missed by just that 25% of the surface coverage. Some of them are water fountains, sink faucet handles, door handles, keyboards, office phones, and vending machines. Talk to people on a regular basis about how dirty keyboards can get. And keyboards are dirty, 3,300 bacteria per inch in the average keyboard. But if you move up to sink faucet handles, 32,000 bacteria per inch in the average sink faucet handles. And just think how often we're washing our hands and touching those sink faucet handles. But if you really are going to want to be grossed out, water fountains, 2.7 million bacteria per inch, the average water fountain. And you better believe when I found that out a while back, I haven't used a water fountain ever since, and neither has my children or family. But there is a solution. And as you see here, enhanced disinfection using electrostatic technology. Really, cleaning is extremely important. Traditional methods are extremely important, but there's a way to be able to get the remaining 75% in half the time. So what exactly do electrostatic sprayers do? They change the electrical charge of particles in the disinfecting solution. So in other words, this is our Protexis handheld sprayer, and it puts out a positive charge and attracts to anything with a neutral or negative charge, like your tables, chairs, desks, anything on that previous slide. And as we know, opposites attract, as in this case. And that positive charge creates the ability to stick and wrap around surfaces, creating that 360-degree technology with a wraparound magnetic effect. And electrostatic charged particles have an attraction up to 75 times gravity, so being able to get to the surface in the quickest possible way, but also in an even fashion. I get asked this question a lot. Actually, people ask me, they say, tell me about your foggers. Well, the Clean infection prevention solution only has electrostatic sprayers. Foggers are completely different. Foggers have been around for a very long time, and they actually traditionally were used for pest control or deodorizing applications, and many of which are not EPA registered. And more recently, have they been paired with chemicals for disinfecting. One of the differences, and you can see the top right is the electrostatic sprayer. Right below that is an example of one of the many foggers. But one of the differences is micron size. 0.5 to 39 microns is considered fogging. Really, it places smaller particles in the air that can remain in the air between 2 and 5 hours, and in a few cases can be up to 24 hours, depending on what type of fogger it is. And those small particles have the ability to be inhaled and potentially cause a health risk. So some of the foggers are wet foggers, which typically used in deodorizing application, ULV foggers, thermal, aerosol, and totally vaporized hydrogen peroxide fogger. So you see the last one being one of the few approved by the EPA, but full PPE is required. Tyvek suit, full respirator, boots, and as well as gloves, etc. So the electrostatic advantage: increased performance, cost reduction, and better efficiency. 360-degree technology extends more surface coverage with less wasted chemicals, actually 65% less chemicals. Cost reduction, obviously that time is money. Labor and chemical costs are reduced by using electrostatic technology, and paired with the right chemical, there's a tremendous amount of additional cost savings. Better efficiency, faster, safer, and more consistent application. I mentioned micron size with the foggers, 60 micron nozzle with this Protexis to ensure the correct droplet size and avoid dripping. So really to have that spray and walk away. Some of the additional benefits: effective coverage, driving disinfectants directly to the surface and into difficult to reach areas. Those difficult to reach, the slide earlier about the water fountain, among others, that's considered in there, but also if you have a gap in a table or desk, it really drives into those cracks and crevices. Also, touchless application not only saves time, but reduces the risk of cross-contamination. Mark has a great slide later showing a cross-contamination example using different applications. Cordless electrostatic sprayers allow for effortless maneuvering from room to room. As we saw with the many different types of foggers, not all electrostatic sprayers are created equal either. There are some that are plug-in that may have a little bit more time consuming going room to room and presenting a tripping hazard. So this is going to be a quick video just showing a litmus test utilizing the typical trigger spray. And as you can see, there's a litmus paper and you want to get that to change color, which it doesn't by spraying the top of the remote with a trigger spray bottle. And then the Protexis handheld sprayer, as you can see, just with the flick of a wrist, it has that wraparound technology and evenly distributes. So The system focuses on process improvement, safety, and cost reduction. 10 times faster than traditional tools while using 65% less chemicals, as mentioned before. Additional cost savings, less sick days convert to higher productivity. And I mentioned the touchless technology mitigates the risk of cross-contamination. It's also a simplified approach. Well, training is extremely important as we focus on that. As you can see with compliance, simple protocols lead to maximum results. One of the big things when focusing on electrostatic technology is the chemistries itself. And Dan's going to actually jump right in and talk about safer chemistries.
So one important topic when you look at surface disinfection is the issue of biofilm on surfaces. I'm sure you're aware of biofilm, you've heard of biofilm, but in most cases, it's really related to water. If you think of the inside of a garden hose, that slime film, that biofilm is protecting the pathogens, whether they're bacteria or viruses, against disinfectant. There's been a number of studies recently looking at very aggressive chemicals at high concentrations, such as bleach and even UV light, and really showing that they are very much challenged against penetrating the biofilm. So this biofilm really protects these pathogens, really the ones you want to go after. And the other point is that normal sampling typically will not detect biofilm as well. So it's really, I would say it's a emerging, in a lot of cases, not well known, if you will, although there is more and more data coming out. And really the chemistry that oxidizing chemistries are generally much more effective against biofilm than other chemicals such as alcohols or quats. A number of the different studies, there's a few of them out there, but in this case, sodium hypochlorite, at very high levels, up to 20,000 ppm, which is really higher than anything you'd ever actually see in the market, with a 10-minute contact time. In these cases, the biofilm, it was impacted, but it definitely was not, destroyed, and therefore those cells were still viable and live. So this was a study back in 2016 looking at sodium hypochlorite. If we go to the next slide, really digs into the multi-drug resistant organisms. This one's really disturbing. If you look at two rounds of terminal cleaning, so you would consider that to be the most aggressive in terms of protocols. This was using bleach product. Over 90% of them had surface biofilms present, and even more, bad news is that half of those were MDROs, or multi-drug resistant organisms. So those are obviously the ones you really want to get to, and this is 2 rounds of terminal cleaning, and these are common surfaces that are usually being cleaned, such as the doorknobs and the mattresses, privacy curtains. So if you're not addressing biofilm with your chemistry, then it's one to look at, and it's becoming a more and more important point. You look at hypochlorous acid, or HOCl. I would say it's become more well known with I would say with COVID. There's been a lot more scrutiny and interest in all sorts of different chemistries. But the beauty of HOCl is that it's uncharged, which means it can really do a great job of penetrating the cell walls. It acts much more quicker than bleach, and it goes against all types, whether bacteria, virus, protozoa, fungi. It's really, HOCl is the first line of defense in your own body. So every mammal actually makes HOCl, and it's really our first line of defense that the white blood cells make in terms of going after pathogens within our own body. There's been no data specific to resistance, but a number of researchers, if you look at the origin of the molecule, given that it's made naturally, a lot of clinicians believe that resistance the HOCl would be difficult to pull off. So that's an important point. This is a video here. It's showing a neutrophil in your body. That's a clear solution attacking a green. That's a staph pathogen. Right as it engages that staph pathogen, it's releasing HOCl. That's in your own body. So that really shows the effectiveness in terms of being a natural molecule that your body, like I said, every mammal produces HOCl. So it's really it's really a ideal type of disinfectant. Some other additional benefits of NADCC, because it's pH neutral, it's much less corrosive than the hypochlorites or bleach. It's also green and sustainable. I think with COVID, it's really pushed a lot of places to look at, because more chemicals are being used, are these products green? Are they sustainable? Are they biodegradable? And NADCC is 100% biodegradable. And it also is much green from a carbon footprint because they're used in tablet form. So you're not shipping water. About 98% of most chemicals are water. So you're shipping the water, you're storing the water. And so you're looking at a very small fraction in terms of transportation and use of that chemical. There's also a new publication coming out next month. It'll be published. It's on 24-hour residual efficacy. This is essentially, one term is residual efficacy, residual kill, essentially the ability of the chemical to continue killing over, acting over a period of time. And this publication will show up to 24 hours of residual efficacy as a disinfectant. So that's with COVID, that's become quite, of interest to a number of different facilities. Really, the last point is that it's registered, it's EPA registered to kill C. diff and also Candida auris. And I would say, and Mark will get into much more of the specifics on how to use best practices, but one of the points is trying to simplify your chemistry. It's not uncommon for a facility to use one product for their floors, to use one product for C. diff patients, one product for their standard disinfection. And the nice thing about NADCC, you can use that across the board. And because it's less corrosive, you would never generally use hypochlorite throughout a facility because it's so corrosive. But in the case of NADCC, more places are being proactive. Instead of just treating the C. diff patients, those patients generally take several days to be identified, which means over that period of time, if they are C. diff positive, then you've got a quicker spread of the C. diff throughout a facility, as well as Candida auris. So there are more the experts in the infectious disease world that are recommending to be more proactive. If you can treat the entire house with a sporicidal or with a chemistry that's has the ability to deal with Candida auris, and that's you're just getting ahead of the game instead of being reactive, and you're trying to chase those patients. This is just the data that was submitted to the EPA on NADCC, and this was shown effective against Pseudomonas as well as Staph aureus, and is very effective. This specific chemistry has a surfactant in it that enables the chemistry to break through the biofilm, and is actually, like I mentioned, has an EPA claim for the removal of surface biofilm. In terms of so a little more specific on the chemistry, the technical chemical term is sodium dichloroisocyanurate. Most people just say NADCC. And when you dissolve these tablets in water, it creates or releases hypochlorous acid. So you're really talking about an HOCl solution that's made on site. And as we talked about, it's a broad, quite potent disinfectant. And again, this is not bleach. Bleach is in the pH of 12 to 13, and with HOCl, it's a pH of 6 to 7. And a really important issue is in terms of safety. When you're looking at the HMIS rating, so that's the health, flammability, reactivity, so the blue, red, yellow. You always want those to be low digits, ideally zeros. In the case of our solution, comes in at a 000, so very safe. And as you look at most, if you look at other products that are able to kill pathogens such as C. diff, this is definitely a benefit to not only your UVS staff but also your infection prevention staff. This is not going to go into detail, but this is some of the data that will be published next month, and definitely exciting that has the ability to continue acting. Obviously, your frequency of disinfection is you want to disinfect as much as possible, but you do have limits. So the fact that you can get some residual is a great benefit. In terms of there's different types of there's essentially three categories of sporicidal. So these would be rated by the EPA to kill C. difficile, NADCC, bleach, and then there's a parasitic acid. And I won't go into all the details, but you can see that while all three are effective and all have a comparable contact time, there's quite a big difference in terms of the health and safety profile of these, as well as the need to use higher levels of PPE. And you can see, because of bleach being highly alkaline on one side of the spectrum and then parasitic acid on the other side being highly acidic, you've got a lot of issues with risk hazards to eye, skin, respiratory, neurological issues, as well as being quite corrosive to different materials and surfaces. So that's, again, you want something that's going to kill these rough pathogens, but at the same time, you want something that's has a much better safety profile. There's a lot of movement away from quad or quaternary ammonium compounds. I would say for the most part, hospitals are in the process or really moving away from quats. In long-term care, I guess that would be a question to the audience. I think you still see a number of different quats. They're used they're sold by virtually every large chemical company. They're inexpensive to make, but there's a number of issues. The reason hospitals are moving away from them mainly is on the efficacy side. You have an issue of quat binding, which we'll go into later in the presentation, that the quat will adhere to the surface of the mop or the bucket, and you end up with a very low concentration, much lower than you would consider. I think that's generally well known in the industry. Studies have been out for a period of time. But when you get into the health effects, I would say these are points that are generally not well known. You are starting to hear more about the health effects, and I'll go into more detail. But you also have issues with you've got some sticky residue on the surfaces, and you also have some issues with trying to dilute using these diluters that can, in some cases, plus or minus 20%. In terms of what's being mixed. It's not does not kill C. diff or Candida auris. And again, for that reason, really more hospitals, and I would say, long-term care nursing homes also moving away from quats and moving more to a sporicidal housewide. Some of the health effects are becoming more and more well known. There's asthma. It's a known asthmatic. There's a number of different types of quats, but these are kind of the core issues. There's issues. There's been some animal studies in terms of damage to animal DNA, and because of some of these issues, you actually will see certain states, like the state of California and the state of Washington, have come out with some. They're not well. In some cases, they're recommending not use quats. In the other cases, they're putting them on notice based on all these issues. So you're going to be hearing more and more, I would say, in the coming years about these health effects of quats. In addition, there's been studies to show antimicrobial resistance. So that's, as we all know, that's really we're obviously focused on COVID at the moment, but in the long-term, midterm, I would say antimicrobial resistance is a huge problem. And then there's even some studies looking at toxicity where they had lower fertility rates in in mice in areas that were using quats versus the non-quats. So there's definitely a lot of, there's a number, many more studies beyond this one, and there's even some social groups that are starting to trying to get some social movement to get more places, at least the awareness of these issues out on the table, so everyone's aware. And so in terms of the product, and Mark will go in a little more detail on this, but the nice thing about NADCC, it can be used across the board with your microfibers, your dry wipes, your spray bottle, your mop heads, and then obviously into the electrostatic sprayer. You just drop one tablet into you fill it up with tap water and drop a tablet into the sprayer. So it's quite simple, and like I mentioned, if you can get away from, if you're using 2 or 3 different chemicals in your facility, it's in a lot of cases those chemistries may or may not be compatible either. It's always good to try to simplify not only the chemistry but the process. In terms of disposal, NADCC is 100% biodegradable in a natural environment, so it degrades into HCl and cyanuric acid, which is that degrades naturally just through natural environment. So that's if in terms of sustainability, I talked a little bit about this, but because you're using tablets and not liquid, you're looking at in one case, 1 truckload of tablets would equal over 40 truckloads of liquid RTU, or ready to use chemical. So if you're looking to reduce some traffic, carbon footprint, handling, even little things like cardboard, there's a lot of sustainability projects even on specifically how do we reduce cardboard. And I think a lot of times, in a lot of cases, your facilities have already taken a number of different measures to improve your sustainability, and you've in some cases hit a wall in terms of what else you can do. So this is it's a novel way to try to be more green and sustainable, and also just storage space, for example, can sometimes be a premium. This is my last slide. Just really looked at the UK. There was a bar graph. The UK is a bar in red, and the US is in green, and that's the C. diff rates. And they converted 100%. UK hospitals went 100% away from using bleach in their hospitals, mainly from a hazardous perspective. And it showed the reduction of C. diff. There were other measures taken, so we're not here to say it was only based on NADCC, but I think it's a good example of countrywide looking at how do we get rid of a chemical that has a lot of issues associated with, and completely ban those from the hospital and move to a more effective new chemistry. And that's they did end up with lower C. diff rates. So we're proud of the work that's been done there. So I think that's a good. I don't see that in the U.S. Happening, but it's on a large scale. It's definitely shows how you can make a big impact.
Thank you, Dan. Okay. So between Dan and Rich, we've heard about some individual components of the overall picture, but one of the things I want to talk to you about is best practices. And let's start with, unfortunately, the science that drives this isn't great and isn't often well defined. There are, however, standard practices, there are guidelines, and there are regulations. And it's amazing to think that we have regulations on things when we don't necessarily know from a scientific perspective that what we're regulated to do actually works. But I'll run through some of those. I'll run through some of the guidelines and point out some of the things like, we all live in a CMS world these days. CMS provide huge amounts of funding, and on the basis that they provide the money, they tend to dictate practice. We hear a lot about what the CDC says they think we should do. And the one thing I always try and remind people is when you hear OSHA, when you hear EPA, when you hear FDA, those are regulatory agencies. The CDC provides guidance, and the basis of much of what we do might be the CDC guidance, that the CDC is not a regulatory agency. Okay, Rich? Okay. Just some basic definitions. Our friend Professor Spaulding provided a range of different categories of object: critical, semi-critical, non-critical, just depending on what that object was going to do, and therefore how high a level of disinfectant we needed. And certainly, if we look at critical items, typically those are objects that are going inside the body cavity. Those require sterilization. But something that you would use as a sterilant or a high-level disinfectant for an instrument was not necessarily something you would use on an environmental surface. And those would much more be non-critical or occasionally semi-critical items. So let's look at what we're trying to do here. Rich? Okay. Non-critical items. If we look at a fairly standard hospital room, obviously depending on where you are in this world, if you're a skilled nursing center, you might have more equipment. If you're a long-term care facility, probably less equipment. However, within the room, there are a range of items which are on the list of things that we need to disinfect on a daily basis. You sometimes call them near patient or high touch surfaces. And things like bed rails. Bed rails should be part of what is disinfected on a daily basis. So is the bedside table. So are things like pressure cuff and basic medical equipment. The key element on this is that not only should those be disinfected on a daily basis, many of them are classified as FDA Class 1 medical devices. I was shocked, surprised, I don't know how you would describe it, when I was first informed that a hospital bed is classified as a medical device. Here we run into our rules. The FDA requires that any Class 1 medical device is cleaned using a disinfectant that is also a Class 1 medical device. That means your disinfectant manufacturer must be an EPA registered facility. It's always an interesting interaction when you talk to your rep, talk to the company that's supplying the disinfectant, and ask them if that is indeed a Class 1 medical device. If it's not, you can use it to clean the walls, the furniture, the floors, but you may not use it to clean anything medical. Just remember, daily and terminal cleans are different. We want you to bundle your approach. So what does bundle your approach mean? We've always heard about infection control bundles. Well, there is an infection control bundle that focuses on the environment. And firstly, do you have policies and procedures defined, written out, and does everyone know what they are? Have you selected the correct cleaning products, and have you made sure that they're compatible with each other? Dan ran through for you a whole bunch of different types of chemistry that could be available. You probably won't be surprised to learn that many of those chemistries are simply not compatible with each other. So if you use quartz and NADCC, quartz and bleach, then you run the risk of having a chemical interaction that will produce nasty odors and may cause irritation to mucous membranes. So you want to make sure, firstly, that any chemistries you use are compatible. But you also want to make sure that the chemistries you use are compatible with the other materials that are in your cleaning program. Your cloths, your wipes, your mops, your brushes. Do they all work together to get the result you need? How are you going to apply the product? Rich gave you an excellent example of a new advanced tool to help you apply disinfectant, to do it more efficiently and to get a better coverage using less chemistry. But you cannot simply spray disinfectant onto surfaces and expect it to work. Obviously, you have to clean surfaces before you apply disinfectant. So you need to, again, determine what the protocol is going to be to apply the disinfectant. When is it applied and how is it applied? Once you have done all of that, you need to educate your personnel. This is not something you can simply expect somebody to walk in off the street and know how to do. I think you need to spend more time and more effort in terms of training than on almost anything else. Once you've trained people, you need to monitor their performance. It doesn't matter how much you train them. If you do not monitor and if you do not record, you may as well have not done it. And finally, as that, you provide feedback. Feedback means you monitor and then educate. That's a very big thing for me, is you do not monitor and then scold performance. These are people who are part of your infection prevention team. I've heard the use of the term infection prevention technologist or infection prevention technician when describing EVS personnel. It's a different way of thinking about your housekeeping personnel. They're not there to clean, they're there to get rid of pathogens. They're part of the prevention program. And as such, you provide them feedback that includes your job is important. Your job is part of making sure that our patients have a safe environment. And this is where you need to improve, and these are the areas you need to look at. Next one, Rich. Okay. Nothing happens in isolation. You're probably bored by now of being told how many multidisciplinary teams you need. Now, this can be a challenge, particularly in the long-term care sector, where you may not have people in all of these roles. You may not even have an infection preventionist. Maybe you have an infection preventionist that you share with multiple other facilities. You probably don't have an epidemiologist, and maybe somebody who is otherwise an infectious disease doctor is going to have to step in and provide some additional service. But you really do need everybody on that team, including, and again, I can't emphasize this enough, your housekeeping staff. They're the people who have to apply these chemistries. They're the ones who on a daily basis are exposed to them. If they are not comfortable with the odor or with the safety of a product, your chances of success are significantly diminished because people simply won't use the product correctly. Okay, Rich? Next. Okay. I mentioned you need a program, a plan. You need a grid. You need to know who is doing what and when. Who's doing what on a day, what gets cleaned on a daily basis, what gets cleaned as part of the terminal cleaning. Again, for acute care, terminal cleaning is obviously something that happens far more frequently than for long-term care. It still happens, however. You need to designate who's responsible for what, who's going to clean what products are going to be used, and what materials are going to be used to apply them. So, especially note special circumstances. What are you going to do when you have a norovirus, an outbreak situation, influenza outbreak, or as we've just seen, COVID? What are our special circumstances, and does everybody know what is required of them? Rich? Okay. As we mentioned, you select your cleaning product. Make sure you have an integrated program, everything working together. What disinfectant, what concentration, what contact time, how it is applied, and what you use to apply the product. And does everything work together? Rich? Okay. So there are certain characteristics that define an ideal disinfectant. You want something that works, that is effective. Dan mentioned quats earlier. Quats are cheap. Quats are low cost. Quats do have a number of drawbacks, however, not least of which is they are very narrow spectrum. Dilutable quats typically do not deal with TB, typically do not deal with C. diff. And it's only some of the newer ones that are effective against small unenveloped viruses. So, do you have a broad spectrum disinfectant? Does it work quickly? 10-minute contact times are probably not a good idea anymore. Is it relatively non-toxic? Is it environmentally sound? Think about how this is going to be applied, and is it compatible with all the other things in your facility. Now, all those other things include the equipment. It includes some very expensive pieces of equipment, but it also includes some basic surfaces, walls, floors, and ceiling. You need a disinfectant that works on all of those. And is it relatively safe and easy to store? One of the things that this gets me in trouble is you will hear marketing people talk about green disinfectants or botanical disinfectants. I would caution you again, this is where the law comes into play. As far as the EPA is concerned, there are no green disinfectants. There are environmentally preferred, but the EPA thinks it's designed to kill, therefore it cannot be green. Next one. Okay. So just as an idea on some of the guidelines that are out there, and some of these guidelines are now incorporated into rules. So the guidelines, typically from the CDC, have actually been adopted by the EPA and the registration of the chemicals. But I'm going to start with C. diff, Clostridioides difficile. Okay, so any room where you have had a C. diff patient must be disinfected on a daily and terminal basis with a sporicidal chemistry. However, not all chemistry is sporicidal. We already mentioned quartz, but phenolics are also not. Hydrogen peroxides are not. The EPA has a thing called List K. That's a list it publishes of all of the approved sporicidal products. If your product is not on List K, it is not sporicidal. The other thing that the EPA has done is written into their methods and their requirements is that every room, every surface in every room has to be pre-cleaned before you apply the disinfectant when you're dealing with C. diff. So if you have a known C. diff room, pre-clean, then disinfect. Now, the pre-clean can be performed with the same chemistry. Ideally, that would be done with the same chemistry with a surfactant in it to help remove dirt. But it doesn't have to be. It can be a different chemistry, provided, of course, it is compatible with the disinfectant. So the rules are pre-clean. Once you have pre-cleaned the surface, whatever wipe you have used to pre-clean that surface must be discarded as biologically hazardous waste. You may now disinfect the surface. Okay. Norovirus, another example, a very challenging virus. If you have an outbreak, your biggest problem is going to be probably staffing your facility, because norovirus has an attack rate of approaching 60% of all those exposed. So the R0 for norovirus is very high. It is highly contagious. The CDC makes recommendations, again, that you follow the EPA L list. The L list is those chemicals shown to be effective against norovirus, and that if you have an outbreak, you should increase your daily cleaning to at least 3 times a day, including, again, removal of any vomitus or other solid material from the surface. And then finally, our current, I'm going to say favorite, maybe last year's favorite, Candida auris, where we are now told to pick a product from the K list if there's no actual C. auris claim on your label. So again, the idea is we are pushing and pushing to get guidelines that basically push us towards using a sporicidal chemistry for all of these issues. Okay, next one, Rich. When we apply the product, what we apply with matters. If we use a cotton cloth, terry cloth, or rag, you stand just as much chance of simply spreading bacteria around the room, particularly if your disinfectant is not broad spectrum. We much prefer the use of microfiber. Microfiber can either be launderable or disposable. If it's launderable, you have to make sure they're in good condition. You have to make sure that the laundry is working efficiently. There have been studies and reports showing laundered microfiber coming back to a facility still containing live bacteria. So there's a cost versus convenience discussion to be had. But the bottom line is you need to collect all of the surface soil and all of the microorganisms, not just move them around. So collect and trap them onto the cloth. You want to make sure that the cloth is sufficiently wetted. Do you know the correct amount of liquid to add to your disposable wipes, add to your launderable wipes to get appropriate coverage? Is it compatible with your disinfectant? If you're using quartz, the answer is probably no. Most quartz will bind to both microfiber and terry cloth. The only solution is to use a disposable wipe that has been impregnated with a surfactant. There's a certain manufacturer that makes cloth called quartz-based wipes. Unless your wipe is pre-infused with surfactant, your quartz will bind and you will not disinfect a surface, just like cleaning with water. The same discussion can also be had with the mop. You need to use a high quality mop to collect dirt, not just move it around. Okay, and absolutely no double dipping. A program that says once a cloth is used, it is either put in a bag to go to a laundry or disposed of. You never put it back into the disinfectant. Okay, next one, Rich. Here we see an example of what happens if you use a cloth that does not adequately capture the bacteria. On the left, you see a sample from a surface before it was cleaned, and on the right, you see a sample from a surface after it was cleaned and disinfected. It was clearly cleaned with an ineffective disinfectant, but also you can see the cloth is depositing more bacteria than it is collecting. You want to avoid that. It is vital that you select materials that are compatible and that capture those bacteria. Next, Rich. Okay. Education. We need to educate our people, and we have to cover a whole bunch of whats and whiches and everything. Train people in the correct technique. Train people in things like the order in which we clean things, top to bottom, outside to inside, unidirectional wiping. All things that need to be taught because they are not intuitive. Things like clean the dirtiest areas last. Okay? Things like do not use the same cloth in the patient room and the bathroom. And remember, this is a team effort. This is more than just one person. Many hospitals have had great success with team cleaning. Put 2 or 3 people in a room working together to clean it rather than one individual on their own. Next, Rich. Okay. And just to give you some idea is, once you've educated, you observe and you supervise. If you fail to observe and you fail to supervise, all your training, all your education will eventually go away and it won't have the impact you expect it to have. And you'll see the quality decline. Next, Rich. Okay, so monitoring, visual inspection, fluorescent markers, colony counts, ATP monitoring, all good techniques, all available. Use them all, but educate once you've monitored, don't scold. Hey, Rich? Final part of this, floors. Most of you who've been around as long as I have will recall the good old bad old days when people told you, don't bother disinfecting the floor, it's dirty anyway. And what's on the floor stays on the floor. That is not true. Curtis Donsky out of Case Western basically did a series of studies that demonstrated that what was ceded to 1 square foot of floor space, essentially within 24 hours could be found on almost every surface in the patient room, and within 48 hours could be found throughout an ICU. What is on the floor does not stay there, it migrates to other parts of the building. If you do not disinfect your floors with an appropriate chemistry, you will not protect your patient population. Next, Rich. Okay, you have limited resources. Let's use them properly. You really don't have time or abilities to train on 4 or 5 different chemistries and on 4 or 5 different application techniques. If you did 4 chemistries and 5 techniques, that's 20 different protocols you have to train to. If that what looks like you when joint commissioner coming in, it shouldn't do. But I can tell you that until we have people adequately trained, there is nothing scarier for a housekeeper than having a guy in a suit and a tie with a clipboard standing watching what they're doing. You better make sure that muscle memory is going to work, and they're going to do it the same way every time and effectively. Okay, next one. So my final plea is let's be proactive. You don't know when you have C. diff in your facility. It's probably there without you ever seeing it. You should consider every room to be a C. diff room and use a sporicidal chemistry every time. Okay, last one. Should be the summary. So summary, we've already said all of this several times, but develop those policies, select the correct products, determine application methods, educate, monitor, and provide feedback. Okay, that's my final slide. So I will hand it back to Megan at this point, and she will do the questions.
Thank you all so much for such a great presentation. We had quite a few questions come through. So we talked about electrostatic cleaning, but I had 5 or 6 folks send in a question that says, what does electrostatic mean? What does it mean to clean electrostatically?
So electrostatic is just putting out that electric charge, and it's based on that theory of opposites attract. So that's where the reference earlier comes into play. We're putting out that electrical or electrostatic charge, positive charge attracting to anything with a negative or neutral charge.
Has anyone reported, or what can be done about an electro sprayer potentially wearing the wax off of a floor or leaving spots if it sits too long or is used improperly?
Can I address that? I mean, we talked about compatible chemistry. So the floor finish is part of your overall chemistry within your facility. It's not just disinfectants and wipes. It's disinfectants with floor finish and tile and grout cleaner and toilet bowl cleaner and glass cleaner and all of the other things that are in your program. You need to make sure everything is compatible. And that's one of the things that if someone sees streaking on the floor or discoloration of their floor finish, maybe you need to look at the compatibility of those items.
Our next set of questions covered some more specifics about the actual electro sprayer device. Things like we had 3 or 4 people ask, how long does a battery last once it's been charged? Or if you're dealing with a tank of cleaner, how much space will that tank clean before you need to replace it?
Sure, I can answer both. There's actually 2 options when it comes to the protective sprayers in general. When it comes to batteries, there's a 4-hour battery and then an 8-hour battery. Both of the handheld device and the backpack come with a 4-hour battery, and it takes 2 hours to charge. And speaking of the handheld, it covers about 1,000 square feet of surface disinfection. It's usually about 30% of an entire room. So if you have a 3,000 square foot facility, the handheld would cover that from a surface perspective. And then the backpack is between 8,000 and 10,000 square feet of surface disinfection.
We had some questions about how this type of cleaning would compare to the bipolar ionization systems that are coming out for HVAC systems. Can anyone speak to that?
These are very different things. Bipolar ionization is a process where you use either a UV or a titanium oxide to generate free radicals, typically either hydroxyl free radicals or ozone free radicals, and those pass through the air. They are still very new. There's still a lot of research and development going on. There's still a limited amount of data on them. Surface disinfection is a requirement from CMS. It's required on a daily basis. The use of air cleaning devices is really something that's just coming, at least a second resurgence in terms of COVID and COVID prevention. So they really are not comparable. They might be complementary efforts.
So we had several folks send in questions about when the conversation about understanding your compatibility of chemicals. Is there a way to, a resource to understand what compatible chemicals look like, or who in a facility should be the resource that they can turn to?
Well, hopefully a very good environmental services manager should have been educated on that. But in terms of an actual resource, typically your supplier should be able to tell you what their chemistry is compatible with. So at this point, you need to make sure your rep, your distributor knows what they're doing and has at least a working relationship, typically with the chemical manufacturer, and the chemical manufacturer will certainly know what their products are compatible with and what they're not compatible with.
If there's any specific questions, if they want to, Megan, send those in and we can respond to those. If there's any specific ones that they have in mind.
Absolutely. So for Dan's comment there, if you do have anything specific that you would like our panelists to address, you can send that to webinars@directsupply.com, and I will make sure that they take a look at it. And now this last question just came through, and it's a question: how long is the mixture stable for? Is it 24 hours or longer? And I'm not entirely sure directly what they're addressing, but maybe that electro sprayer mix.
Dan, okay. Yeah. So the chemistry in the tablet format is stable for between 3 and 5 years. Once you have diluted the tablet into water, it is actually stable for between 5 and 7 days. Depending on which product, which brand you're looking at, there are different EPA label notifications. Different chemistries have different stabilities. Most NADCC solutions are good, let's say, between 5 and 7 days.
And then the very last question that we've got here for you today is it possible to see a biofilm on a surface?
Yes. Typically you see them on wet surfaces. So if you run your finger over a rock in a river, that slime layer is biofilm. The plaque on your teeth is biofilm. Now, I think the question more relates to in a hospital or a healthcare setting, whereas surface is normally dry. There are some new devices coming onto the market, which are very clever, multi-wavelength UV lights that do cause certain proteins within the biofilm to fluoresce. And within the next few months and years, you should start to see those as available. And yes, you will then be able to visualize biofilm on a surface.
But in most facilities today, I would say, don't have those technologies. They, in most cases, you would not, unfortunately, be able to see it unless you have some of these new technologies.
Sure. And then one more question just slid in, and I think it's pretty relevant, so I'm gonna get it before you guys. What temperature should mop water be kept at for use?
70 to 75 degrees Fahrenheit is perfectly fine.
Excellent. Okay. Well, that's everything that came through for our Q&A. So thank you to all of our attendees for those awesome questions. And thank you, Rich, Mark, and Dan, for your expertise and your time today.